The objective of this intervention is to place a sling, a short sling with 2 traction suture threads, as a support of the bladder connected to a prosthesis that will permit the sling elevation regulation if needed at any moment during the patient's life, assuring the control of the stress incontinence and avoiding future interventions. With the patient in gynecological position, we will prepare the surgical field by a vaginal valve. We will start by doing an inverted U incision in the anterior vaginal wall, preparing the submucosal space to present the best possible view of the urethra tract. We will make a small transversal incision at the abdominal midline, just over the pubis. We will open the fat until the fascia of the abdominal rectal muscles is clearly patent. With a cutting electrode, we will make 2 marks where the suture traction threads should cross the fascia of the abdominal rectal muscles. The marks should be in the midline, just over the pubis and separated approximately 3 centimeters one from each other. We will push the suture thread passers through the retsua space until we can clearly see the tip of the passers at the abdominal incision. We can connect and use the passer handle to drive the suture thread passer and succeed in crossing the fascia of the abdominal rectal muscles through the points previously marked with a cutting electrode. We can also use bladder mobilization techniques to avoid bladder perforation. At this point, we will perform a cystoscopy to check the bladder integrity and assure that we did not perforate the bladder with the suture thread passers. After getting the sling from the sterile container, we will place it at the midline of the anterior vaginal wall incision, at the level of the bladder-urethra union. At this point, we will fix the sling with 2 absorbable suture knots to avoid the sling antero-posterior or lateral displacement. Then we will place the traction suture threads of the sling through the holes in the proximal part of each suture thread passer. Moving forward the suture thread passers, we will pull the traction threads until we can get the suture threads at the abdominal incision. The assistant will clamp the suture threads with a hemostat. After getting the Remeex prosthesis from its sterile package, we will transport it to the abdominal surgical field. We will insert the traction suture threads through the varitensor respective side reception hole, and the suture threads will come out through the central outcome hole at the varitensor midline. Once this step is completed, we will ask the assistant to maintain the Remeex prosthesis in the midline, 10 centimeters over the fascia of the abdominal rectal muscles. And we will knot the right side traction suture threads with the left side traction suture threads by doing 3 knots, 1 in each direction. It is important to make sure that, with the prosthesis in the midline, we leave the same length of traction suture thread coming from the sling at each side of the varitensor. By rotating the manipulator clockwise, the traction suture threads will wind into the varitensor. We will rotate the manipulator until the prosthesis rests over the fascia of the abdominal muscles. Once the prosthesis rests over the fascia, by rotating the manipulator clockwise, we will elevate the sling to the desired level. And rotating it counterclockwise, we will reverse the traction of the suture thread, letting the sling go down. We can reach the proper position of the bladder suspension by filling the bladder with 300 cc's of saline, and then pressing the lower abdomen while rotating the manipulator until only a few drops come out of the urethra orifice. We can also reach the adequate tension of the threads by the Q-tip test system, explained in the surgery step-by-step section. After the right support of the bladder is reached, we can proceed to the vaginal incision closure and the abdominal incision closure, leaving the head of the manipulator showing at the center of the abdominal closure. If the patient does not have any additional pathology, we can discharge her the same day or the following day of the intervention. With the Remeex system, we will have the chance of regulating the sling support whenever it is needed, during the intervention, after months, or years from the intervention. Before patient discharge, we will disconnect the manipulator by attaching the disconnector to the manipulator and rotating the disconnector 1/4 round in relation to the manipulator until the positioning marks are separated 90 degrees, while pulling the manipulator a little bit. The manipulator will come out easily. The Remeex system offers the possibility to modify the sling support level after the surgical intervention. How can we adjust the sling level? After injecting local anesthesia in the abdominal midline just over the pubis, where the Remeex prosthesis is, we will make a minimal incision to reach the prosthesis. We will connect the manipulator to the varitensor by introducing the manipulator into the varitensor and rotating the disconnector 1/4 around versus the manipulator to secure it to the varitensor. We will be able to modify the urethra suspension level by rotating the manipulator clockwise until we reach the desired urinary continence, with the bladder filled with saline and doing the common pressure maneuvers. We can also modify the urethral support by activating the varitensor mechanism directly with the disconnector, like a screwdriver, avoiding the manipulator connection step. This sling level modification maneuver can be made whenever needed due to physical changes, variations in patient's physical activity, or any other change during patient's life.